And we're recording. Hello, Demi. How are you?
I'm good. How are you?
Good. I'm Sarah Russell. Perform some hand hygiene and we'll get going here. All right. My name is Sarah Russell and I'm a Columbus State student, and I need to do a head-to-toe assessment on you for one of our assignments. Do you agree to take place in this?
I do agree.
Okay. Now state your name again. I know your name is Demi Russell, but you tell me your name and date of birth.
My name is Demi Russell, and my birthday is 10/16/2006.
Okay. And that makes you how old?
19 years old.
All right, so she's old enough for this video, and Demi is a good historian, and she's able to perform the things I'm going to ask her to do, and we are ready to go. So, Demi, you told us what year we are in. Where are you today?
I'm at home.
Oh, great. I'm going to use my clipboard here and make note of a lot of assessment questions. So we're going to be doing this for probably a little bit over 20 minutes. So here we go. We've already gone over the first part, and you've already told me the place and time. Hygiene is good. All right, Demi, your respirations are even and in labor. Let's have you sit up straight. All right, that's great. I'm going to start off by taking a look at your skin, starting with your face, looking for any lesions. All right, let's look at your arms, looking at the hair distribution. I have a lot of hair. Great, no alopecia noted. All right, let's look at your fingernails. All right, you have some nice pink nail beds. Capillary refills less than 3. Let me see this side. Skin turgor is elastic with good and immediate recoil. All right, let me inspect your legs for any wounds or lesions. Any troubles with your legs that we need to know about?
No, ma'am.
Good capillary refill here as well, and bilateral feet. Good skin turgor. All right, thank you. We will be moving on. Let's move on to your scalp, Demi. All right, already assessed your scalp. Hair was good, no alopecia. Any tenderness on palpation of the skull?
No, ma'am.
Everything is symmetrical and intact here. All right, great. Thank you, Demi. We're going to do a little exercise here to assess if you have any TMJ, any issues here. I want you to open and close. All right, and then side to side. Any issues there, any pain?
No, ma'am.
All right, and for the video assessment, we will say there is no clicking, one more time, no crepitus, and no pain upon palpitation of the TMJ joint. Next, we're going to move on to cranial nerve 5, which is the trigeminal nerve. And with this, we're going to be assessing your beautiful teeth. Let's see. Oh, nice. It appears as if you've already had braces. Yeah, your teeth look great. All right.
Thanks.
I'm going to palpate here in the temporal area, the masseter muscles. Great. Those are both equal. Open and shut again. All right. Thank you. Now we're going to assess. Close your eyes. Where do you feel me touching, Demi?
The sides of my face,
All
my
right.
cheeks.
All right, so facial sensation is intact on both sides. All right, let's move on. We're going to move on to your actual facial nerves, which is going to be facial nerve 7. So how about you smile for me? Puff your cheeks out. Frown. Eyebrows up. Okay, great. Thank you for that. We already looked at your teeth, and from that assessment there, you have your face is symmetrical upon smiling, frowning, eyebrows up. Nice. All right, next we're going to move on to your eyes. Just going to do a little bit of testing here. I'm going to use my ophthalmoscope to look at your eyes. First, we're going to look at your sclera, your conjunctiva. This eye, which is the right eye, is clear. No lesions noted. No lesions noted to the left eye. Also noted a pink conjunctiva. Sclera is white. Great. Next, we're going to move on and do a little bit of an eye assessment, okay? You just stay still, and I'm going to use this light, and I'm going to look to see if your pupils are going to constrict, okay? You're just going to stay there, and I'm going to follow your eyes with this light. Great. Right, you just Great, and I'm gonna do it again. I'm gonna look in the opposite eye to see if it does it on this side. Great. Okay, thank you for that. Let me make note on that. That was assessing your extraocular movements on cranial nerve 3, 4, and 6. There was no nystagmus noted. You were able to follow the light with no problems at all. So next we'll be moving on to the ears. We're going to be looking at, I'm going to have to assess the inside of your ears, and this is just again a little palpation, not palpitation. Any pain there?
No, ma'am.
And the auricles look good. They're both symmetrical. No pain noted to the temporal area. Now we're going to assess your tympanic membranes. No issues noted on the mastoid. Okay, I'm going to turn that way. I'm going to pull your auricles up and back, and I'm going to go very slowly to look in your ears, okay? Tympanic membranes are clear and pearly on the right side. Make sure the video can see us. Tympanic membranes are pearly and clear to the left side. Okay, make note of that here. No tenderness, as you said. Your ears look good. They're visible landmarks, pearly gray to both sides. Now we're going to move on and we're going to assess your cranial nerve 8, which is your acoustic nerve, okay? We're going to just do a little test, and what I'm going to do, let me put this down. I am going to, you're going to cover your ear, and I'm going to say a word, and you tell me if you can hear it. I'm going to turn this way. Cover your whole ear with your hand, okay?
Pig. Pig.
All right, now cover your other ear. I'm gonna stand 5 feet away. Yeah.
Yellow.
Good job. All right, the next test we're gonna do, and your hearing here is intact bilaterally, if that's from that test. This is a tuning fork, and I'm gonna put this on the center of your head, and you just tell me when if you hear the noise, okay? I'm gonna strike it and put it on top of your head. You hear it?
Yeah.
Oh, good. Hear it in both ears?
Yes, ma'am.
Good. That means that the sound is lateralized equally. That's good. We're going to do the same thing. I'm going to strike the tuning fork. Going to go back here and then bring the tuning fork here on both sides and tell me when you hear it.
I hear it.
Okay.
And I hear it.
All right, good. In this test, you did good on that. That means that the air conduction was greater than the bone conduction. So you passed the test. All right, moving on. We will move on, and we're just going to take a look at your gums. Once again, I'm going to use my light and just kind of take a look and see if everything's okay, all right? I'm going to check out your dentation, your oral mucosa. All right, let's open up. Dentation is good. Oral mucosa pink and moist. Tonsils look good. No exudate noted. No redness noted. Uvula is midline. Thank you. Moving on. We're going to move on. Tongue was midline as well. We're going to move on to cranial nerves 9 and 10, which are, all I'm going to do is ask you to say, ah, but let me look really closely as you say, ah. Ah. Once again, uvula is still midline. Okay? And then we're going to do your gag reflex, which I'm just going to stick this Q-tip in your mouth, and then we'll see if you have a gag reflex. Just, ah. Gag reflex. Ah. Okay. Gag reflex is present. Gag reflex is present. Thank you. Next, we're going to do cranial nerve 10, and this is where I'm going to assess a little bit of the strength here. So as I please shrug your shoulders against the resistance. Now, all right, there we go. Good. Okay, strength is good. Equal bilaterally in both shoulders. Now I'm going to put my hand here. Turn your head to it and put a little pressure there. Good. Same thing on this side. A little pressure. Good. So good. Good strength in both sides bilaterally. All right, let's move on to some lymph nodes. We're gonna do some palpating, which is just 2 fingers, and just feeling for any lymphadenopathy. Hard to say sometimes. We're gonna check it. There's lots of lymph nodes here, starting from back here, and then we move around, feeling for any abnormalities, all the way from down to the submandibular, to the submetal, to the anticlavicle, clavicular. Then we even want to do the posterior lymph nodes. Okay, thank you. If I caused you any pain, I'm sorry. On that one, we did the preocular, we did the postocular, we did your occipital, we did the tonsillar, we did the submandibular, we did the submetal, we did the anterior cervical, we did the posterior cervical, okay? And there was no lymphadenopathy noted at all. Thank you for that. We've already sit up straight. The trachea, upon palpation, is at midline. Moving on to your thyroid. So with the thyroid, we like to have the patient stand up. We're also looking for enlargement here and make sure there's no palpable nodules. Sit up straight. I'm just going to place my fingers around this area to see if I can palpate any enlargement. But swallow for me. One more time. Okay, good. There's no enlargement there. Same thing again, no lymphadenopathy. I can't get that word out. Lymphadenopathy, okay? Thank you. Now, I'm just gonna look at the configuration of your respirations as you breathe in, breathe out. Good, the chest is symmetrical as you breathe in and out. Your respirations are even and unlabored. Great there. Now, I'm going to palpate a little bit more of your nodes, your supraclavicular nodes. Once again, there's no enlargement noted. Now put your arms up and let's do your axillary nodes. No enlargement noted there. Any tenderness upon palpation? And there was no tenderness upon this as well. Okay, you can put your arms down. Thank you for that. We will move on. We're going to palpate your carotid arteries. This is still going to consist of just 2 fingers on the side, feeling for that artery. 2+ on this side, and 2+ on that side. When we assess these, we use different fingers, but upon assessment, they're still equal bilaterally. I can feel them. Good, strong pulses here. Next, I'm going to use my stethoscope to listen to your apical impulse. This is located at your 5th intercostal space, which is near your midclavicular line. Be able to see this. 1, 2, 3, 4, 5. Apical impulse is noted. All right, now I'm just going to use my stethoscope and I'm going to listen to your lungs, okay? You're going to take a deep breath in and a deep breath out. Start here and work our way around in a zigzag motion. Take a deep breath in, out, in, out, again, again. Good. Moving on down. In. Out. In. Out. Good. In. Out. Nice. And again, one more time. In and out. Okay. Great. Next, we're going to listen to some heart sounds. You have 5 cardiac landmarks, and we're going to start here. Let's try to get on this side. This is the aortic, and there's no breathing here. I'm just listening for S1 and S2. which is noted here. Pulmonic, noted. Erb's point. Tricuspid. And at the lowest point, the mitral valve. Okay, lub dub is noted in all valves. All S1 and S2 are present. No murmurs or gallops are appreciated. All right, next I'm gonna turn you around and look at your thoracic. Look at the posterior aspect of your thoracic area. Sit straight up, symmetrical. Take a deep breath in and deep breath out. Okay, I'm gonna put my hands below your ribs, expand out. Take another deep breath and out. All right, thoracic expansion is symmetrical. I'm gonna perform a test on the very lower aspect here and let me know. This is called the CVA. If you feel any tenderness here, let me know. I'm gonna place my hands right here below your ribs and I'm gonna strike my hand and let me know if you feel any pain, okay?
Okay.
1, 2, 3.
No pain.
Okay, you come on to this side. And let me turn around so the video can see it. So hand down here, and you just strike. No pain?
No pain.
No CVA tenderness noted upon palpation. Thank you. And we'll also, I'm gonna listen to your lungs since we did the anterior side. Let's just do it in and out. I'll let you know when to start. On your posterior lungs, okay? Take a deep breath in, blow out. Great job. In and out. 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 One more time. In and out. Uh-oh, let me turn on this side of the video. Okay, in and out. Okay, and then in and out. Nice. Okay, lungs are clear bilaterally. Lungs are clear in all fields. All right, let me get my checklist out of the way and check off that the lungs were clear. Next, I'm gonna have you lie down. Let me move my hand sanitizer. We're gonna look, listen, and feel to your abdomen, okay, to make sure that we don't have any abnormalities noted, okay? Let me put my paper down here. All right, let's get this over here so the camera can see you. Right now, I'm just inspecting your abdomen. You look first, okay? Everything looks symmetrical there. And then I'm going to listen next. I'm going to auscultate and I'm going to listen to your bowel sounds. We want to see if they're hyper or hypoactive. I'm going to start here in the upper quadrant. It may take a second or not. There we go. Okay, vowel sounds noted to all 4 quadrants. They're all normal active. Okay, next, we're gonna do a little percussion. I'm gonna do a little tapping. Sorry, ma'am. timpani, hear that talk? It predominates, the timpani predominates throughout upon percussion. Perfect, that's great. Now I'm gonna lightly palpate. I wanna let me know if there's any pain upon palpation. Any pain?
No, ma'am.
Okay. I'm gonna do a little deeper dive here. Any pain?
No, ma'am.
Okay, so abdomen is soft. There's no tenderness, there's no enlargement, no organomegaly noted upon assessment, upon palpation. Okay, great. Now I'm gonna let you, actually, as you lie there, I'm going to do some assessing of your jugular veins. No distension noted there. Great. Let me check your capillary refill again. Less than 3. No edema noted, no clubbing noted. All right. Now, I'm going to palpate some more pulses, okay? As you lie there, we will palpate. This is your brachial pulse. So both equal and strong, 2+ bilaterally. Your radial pulse. Same with the radial pulse, equal, both are strong, 2+. Now I'm gonna go a little further down behind the knee is your popliteal pulse. Popliteal pulse is the correct verbiage. Popliteal pulse noted, 2+ to bilateral. Legs. Okay, now we're gonna check your dorsalis pedis pulses. 2+, those are very strong, easily palpated. Make sure the video can see us. Let me do those again. Dorsalis pedis pulse on the right was 2+. Same on the right. Now we're gonna do the posterior pulses. Those are both equal. Now I'm gonna go a little bit deeper here. These will be your femoral pulses. And for the video, I did not state that these here, once again, were posterior tibialis pulses were both 2+. Same with the femoral pulses. They're both 2+, and they're all equal. All the pulses are equal. That's great, thank you. Next, I'm gonna use the bell of my stethoscope. I'm gonna listen for breweries, starting with your carotid. No brewers noted. Aorta. No breweries noted. We're going to work our way down. We're going to assess the renal breweries, the iliac, and once again, now we're assessing the femoral. No breweries upon auscultation are noted. Okay, great. No breweries noted. Now I'm gonna have you turn around and sit back up for me, okay? And we're gonna do some neurological assessments. I'm gonna put my hand up, touch your nose, and then touch my finger. Do it on the other hand. Okay, good. No dissymmetry noted there. Now, you're gonna flip your hands back and forth, alternating. Nice, everything is intact there, no problem with that at all. Rapid movements are intact. Now, we're gonna get you to do a Romberg's test, which is where you just close your eyes, stand up straight, and put your hands out to the side for me. And then after that, I'm gonna ask you to do a heel to toe. We're just looking to see if the gait is steady or not steady. So let's start with the Rombergs. Close your eyes, hands out. Good job. Let's do it again. Hands down, close your eyes, hands up. Romberg's test is negative. Let's get over here and we're going to do a little sensory check. Not a sensory check, but back to the neuro check. You're just going to do heel to toe. Ooh, I'm performing it not very well. Hopefully you'll do better than me. Back up. Let's look straight ahead. Okay, gait is steady. That is good. Okay, now we're going to do sensory check where you're going to close your eyes, have a seat, and tell me where you feel this.
My cheek.
What cheek is it?
My left cheek.
What cheek is this?
My right cheek.
What is this?
My left quad.
And what is this?
My right quad.
Okay, good. Sensation is definitely intact bilaterally. Next, I'm going to use my equipment and I'm going to check your deep tendon reflexes. So when you feel them, you're going to feel a little jerky motion, okay? If it's uncomfortable, let me know. So we're going to start with your biceps. Usually, I'm going to place my hand here. When I pop it, you'll feel the reflex and you'll jump, even though this is not a true reflex. There you go. Good. Now let's let's do this side so we can say, oh, good. Reflexes are positive bilaterally. They're 2+, and then we're going to do your triceps. I want you to bend. Okay. Put that in there. Now we're going to oh, perfect. Oh, good. You have great reflexes in your biceps and your triceps. Next, I'm going to feel right here on this pad, your patellar, and I'm going to go below it, and you should feel your legs should have a reflex. Great.
Can you be a little careful right here, please, ma'am? I have Osgood-Schlatter in this knee.
Oh, sure. Good. Now, we're going to do your Achilles reflexes. Keep your foot flat. Just relax. And again. Good. Now let's try this one. Achilles reflexes are 2+ bilaterally. And the biceps were 2+, triceps 2+. That one was, patellar was 2+, and the Achilles was 2+. Good job. Next, I'm just gonna assess your musculoskeletal posture upright. Let me assess. Posture is erect. Spine is aligned. We're good on that. Now we're just gonna do a little range of motion. Raise your hands above your head, arms above your head. Any pain or anything with that? Hands back down. Okay, great. Bend and extend your elbows. Okay, and let's just do some wrist movements. All right, I'll have you stand up. Bend your knees. Okay, and move your ankles up and down and up and down. Good job. And your range of motion is full. Any pain noted?
No pain.
Full range of motion without any pain. Last but not least, we're going to assess your strength. So I'm going to put my hands up and I'm going to push and you push me back. Okay. That would be a positive sign that you have good strength there. Now, squeeze my hands, Okay, bilateral strength noted there as well. Now I'm gonna have you sit down, and you try to push your knee up as I push it down. Okay, great strength there. One more time. Strength is 5 out of 5 in upper and lower extremities. Good job. One more time if you pushing me back as I push you. Okay, great job. All right, well this concludes our assessment. Do you have any questions or anything for me, Demi?
No, ma'am, I don't.
All right, thank you for participating in my video. And Demi's blood pressure before this we did was 120/80, and she weighs 142 pounds. Thank you.